Hello and welcome to India Top Doctor. Today we are back with another episode of the Health Dialogue. And today we will be talking about the effect of COVID-19 on cardiac patients. The recent outbreak of coronavirus disease 2019, COVID-19, caused by severe acute respiratory syndrome, coronavirus 2, has been declared a public health emergency of international concern. COVID-19 may present as acute respiratory distress syndrome in severe cases, and patients with pre-existing cardiovascular comorbidities are reported to be the most vulnerable. Therefore, understanding the effects of COVID-19 on the vast cardiovascular system is essential for providing comprehensive medical care for critically ill patients. To know more about this, today we have with us Dr. Nabajit Talukdar. So let's welcome him. Before we move, can you tell us something about yourself?
Well, I am an interventional cardiologist, electrophysiologist, working with Batra Hospital, New Delhi. And I have, apart from cardiology, other patients as reading, writing, and in general, social works in relation to humanity. So that's me. I'm otherwise a simple person.
That's good to know, sir. So as you know that we will be talking about the effect of COVID-19 on cardiac patients, but before we talk about that, can you tell us what is cardiovascular diseases in patients with COVID-19? What are the different kinds of diseases?
Well, as you know, 3 waves of COVID had hit us. One very different patterns. First one was out of the blue. Second, we had been hard hit, and the third one was relatively minor. Now, question is about what it has in terms of cardiovascular disease. Well, in COVID patients, our data and the international data also clearly says that as many as 60 to 70% of patients with COVID has some or other form of heart involvement. Now, these may be overt heart disease or covert heart disease or risk factor for heart disease. Commonest risk factors being presence of smoking, hypertension, diabetes, and in many cases, these are not controlled. Also, during the COVID progression, many of the things are complicated by the use of steroids, etc., which tends to worsen the diabetes control, sometimes increasing the blood pressure precipitously. So these are a complex interplay of cardiovascular disease and COVID. Also, COVID being affected by presence of blood clotting, we know, particularly in the venous system, many times, many patients, we did find heart attacks happening or frank MI or myocardial infarctions happening. The lung thrombus and the pulmonary embolism was also encountered by us. We also encountered a wide range of peripheral vascular disease, meaning blood clotting in other parts of the body apart from the lungs and heart. So there is a myriad involvement of the heart in relation to COVID.
So how is one supposed to take care of themselves post-COVID, and especially the heart patients?
Well, heart patients is, I would like to answer it this way. One part is during the COVID. So during the COVID, whatever you are suffering from or whatever your medications are, that has not to be changed. Like in early years, early part of the COVID, there was some aspersions about the use of AC inhibitor, which was later found to be untrue. And hence, a patient on AC inhibitor or any kind of drugs, he has to inform his doctor who is taking care of the COVID, and those drugs are to be continued until your cardiologist say not to. But then without consulting, you should not be stopping any kind of medications. Also, meticulous recording of the blood pressure and the sugars are imperative. because at home this can be done. In the COVID and post-COVID era, we need to check our blood pressure. These days it is very easy. We have a wide array of blood pressure recording instruments available. The blood glucose monitoring are available as low as 350, 400 rupees. You can buy one. You can keep a close check on your these two correctable features and inform your doctors accordingly. Also, you have to be very observant of any new symptoms happening, like worsening of shortness of breath, a sudden feeling of breathlessness, chest pain, particularly unexplained chest pain in the center of the chest, going to the left arm or to the jaw. If you're a patient with bypass, you have to notice any other change. Also, if you suffer too much of palpitation, if you suffer skip beats, if you suffer dizziness, if there is a tendency to fall down, if suddenly you feel pukish and very undue sweating, all these features should make you seek medical consultation immediately.
Right. So you really gave us some important tips for our audience. I'm sure it was very helpful. Now, talking about the older patients, the adults, the older adults actually, they are more prone to COVID-19, and especially the people with cardiovascular disease. So, how can you give some considerations for them?
Well, this statement is not entirely true. What is true, I'll tell you.
Yes.
Actually, the elderly patients are more prone to heart disease because of their age, because of the various comorbid features, they're more prone. These patients, if they suffer COVID, their chances of complications are worse, especially patients who are more than 65 years of age. And it has been trial proven, and many of the trials have proven it. Patients more than 65 years of age, if they have already heart disease, now COVID, the presence or absence of heart disease doesn't increase the probability of catching COVID. However, if those patients catch COVID, then their chances of complications are more. That is the fact.
Right, right.
So patients should not be afraid that I am a heart disease, I will catch COVID. Not like that. Your chances of getting COVID is similar to a normal population. However, if you get COVID, you are likely to be hit badly, and especially if you are not vaccinated. So most of the bad uh, outcomes has happened in those who are never vaccinated and who are having serious disease, or somebody who has not taken care of their medications or the heart condition as such. Those patients are more prone for different kind of, you know, illnesses and post-COVID complications. Another part, very careful is to be mentioned. Post-COVID, we should not just have 14 days has happened, your RT-PCR negative, you are feeling fine. That should not make you complacent, because post-COVID complications are a reality. There is persistent weakness. Many of the patients suffer from arrhythmias, meaning abnormalities of the rhythm. Then you may suffer undue fatigue, breathlessness. And if you have got a severe lung involvement and already your heart is involved, so the chances of you falling sick is more post-COVID.
That's really, I mean, I don't know what to say about that, but you really busted a very big myth about heart patients being more. I mean, heart patients are not equally as prone to COVID as others. It's just that if they catch COVID, they will be more prone, right?
Yeah, yeah.
So, COVID-19 sure brought some very drastic changes in the world. And the most important thing in that was the economic change, the drastic change in economics. But people still go to their workplace, they have to be economically active. So, how should patients with cardiovascular conditions manage workplace exposure during COVID-19?
Well, that's a pertinent question. First of all, remove fear. COVID is a disease not killing you by very high percentage. Only 1 to 2% of the patient, at the max 3% of the patients die. And in this newer COVID Omicron, the death rate is still lesser. So that you will catch COVID and you will die, these aspersions should go. Now, what can we do? Persons who are already having heart condition is bad, who are already on different medicines, they have to limit their exposure to whatever extent is possible. And they have to maintain social distancing and blah, blah, and all these mask infection, etc. But if you are a patient, say 10 years back or 5 years back, you had an angioplasty or a bypass, and you are stable now, your heart function is okay, you are stable with medicines, you don't have to fear. You just take what other persons are doing. You know, it is only the sickest of the lot and very elderly who needs extra care. Otherwise, not. First of all, be in touch with your doctor, with your cardiologist, and remove the fear. It is the fear which kills, not the killer as such. That's what I want to emphasize.
Right. People have to be strong psychologically.
Yeah.
So, sir, you mentioned about hypertension before. I wanted to ask that what is the link between hypertension and COVID-19?
Well, there is no direct link, but hypertension has been, by dint of its sheer presence, hypertension has been one of the commonest comorbid features available with patients with COVID. See, we have an urban prevalence of around 40% of hypertensives in India. And in India, hypertension affects us 10 years earlier than the Western counterpart. In West, it is more than 50 years are involved. In India, 40 years and all they are involved. So if your number of hypertensive is more, obviously, along with COVID also, the commonest comorbidity will be hypertension. So that is the link. And in hypertensive patients, one thing you have to mention is not to go slack about your hypertension control, not to go slack with your medicines. You have to take on the monitoring of blood pressure and taking regular medicines in consultation with your say nephrologist or hypertensive patient, either cardiologist or physician, whomever you are seeing. So you have to be in tandem with them.
Okay. So many people have this one a frequent question that what is home-based cardiac rehabilitation and how could it be used during COVID-19? Can you tell us about that?
We used it a lot. What we did, we took the help of simple things, like patients might not be able to tell you the pulse rate or something. What you can do, you can use the simple, humble pulse oximeter like this. Put it in your, uh, fingers, and it will give you the pulse. It will give you the pulse, count of the pulse and the saturation at an instant. And if the patient shows it to the physician, it is possible for the physician to detect even abnormal heart rates. So this is a very simple tool you can use. Now, if you have an Apple Watch, you can easily have the ECG transmitted to you.
Right.
So now we also have small patch ECGs, which are not very costly to detect the abnormalities of rhythm. We just put a patch here, and it is directly connected with my mail and in my mobile. So for 3 days or 7 days, we put the patch, and the data comes to me directly online on my mobile. So this is nowadays state of the art. You can practice it. Blood pressure measurement is very simple. You can have just a cuff tied to you, put on the button, and the blood pressure comes. Also, this kind of device, plethysmography based device, some devices give blood pressure also, digital blood pressure. So All this monitoring can be used along with the blood glucose monitoring. Patients can real time connect with the caregivers or the heart failure clinics or the coronary artery disease clinics. They can be in touch with the doctor and their team, and we can monitor the patients in real time. This has the COVID, if it is given so many bad things, it has also developed, use of IT and use of information technology in a very big way. So simple things we can do. It is so easy,
Right.
like this simple, humble pulse oximeter can be used for so many reasons. Not only oxygen saturation, you can see the pulse rate, you can see the variation of the pulse, you can see the whether the pulse is regular or irregular, and everything. This is so simple. All we need is to apply our mind. It is not necessary to go for very big equipments or something. We can use whatever available with us with a little bit of dexterity, and you know we can do wonders.
It was a really eye-opening session we had with you, sir. So we're talking about COVID-19. My question now, my last question would be for you, that you are a frontline worker. How are you as a doctor taking care of all the COVID protocols for your safety or your patient's safety or your family's safety?
One thing I did not take a single day leave during the entire COVID. Last 2.5 years, I did not go for holiday because it is not because of the COVID. I thought it was my humanitarian duty to be part. Yes, I'm an intervention cardiologist. Our number of intervention had come down during the COVID. We actually performed less interventions during non-essential procedures. We did not perform, but then we also did not shy out from performing uh, many cases during the COVID. Just for the heck of COVID, we had not delayed any process. There were times we took uh, PP, everything. See, many of the things we are wiser in retrospect. Now we understand that PP is not that important what it was made out to be. I personally did not use too much of an PP, but yes, uh, you have to maintain the discipline protocol or whatever. So some amount of PPEs was there. Masking unnecessarily, I don't do. Yes, when you are in a COVID ward, you put on the mask. And if you wear a mask, this kind of mask will not help. It should be N95 mask, preferably double layered, and there should not be any gap between it. All these protocols I maintained, took vaccination. So these things were maintained. But yes, washing of clothes, then sleeping, uh, many other things, kara and all this stuff, these things I did not do. And neither was this required. This was, so many crazy things happened. There were products available in the market which advised vegetables to be washed. Vegetable washer soap had come up. Okay. Now, vegetables, you should be scientific that COVID doesn't transmit to vegetables. So these kind of thoughts and these kind of what to say, misguided information, we should be all be responsible so that people don't suffer from undue stress. At the same time, we should make people aware that the death caused by COVID is less than tuberculosis. It is less than that caused by malaria. It is less than that caused by dengue. So the irrational fear has no place in our this time of life.
Right, sir. So it was so great talking to you, sir. I
Nice
really had
here.
a very good time. Thank you so much, sir.
Thank you, and I wish you a good day.
You too, sir. Thank you.
Thank you.
And if you guys want to book an appointment of Dr. Nabajit, you can do the same by visiting India Top Doctor. Till then, keep watching. And for more such videos, do follow India Top Doctor. Thank you.